Good afternoon, I'm Mabel Jong, and you're watching the World Healthcare Congress coverage of 2015. I'm so pleased to have with me now Dr. David James, CEO of Memorial Hermann Medical Group. Great to see you, Dr. James.
Great to be here, Mabel.
Are you encouraged by all of the talk about consumerism in the marketplace and how that's really going to benefit the consumer in the long run?
Yeah, you know, I'm surprised it's taken this long in this arena to get people to be consumers of healthcare, but it's a good thing.
Yes, and what are the challenges that the individuals are facing now that they really do hold the power over how they want their healthcare delivered?
Yeah, it is a challenge because of how it's come about. You know, there's a big cost shifting taking place. So we all know that healthcare has a cost problem, and the health insurers are increasingly shifting a lot of that cost onto the consumer. And I think that's what's driving the consumer to become a consumer, because it's coming a lot out of their own paycheck. So I think that they're becoming, they want to be savvy, they want to understand, they're demanding convenience, they're demanding access, but the healthcare industry is still not fully responded to that yet. And the healthcare industry itself is hard to move, and we're having to pivot to face this ambulatory care environment, face the consumer, and start to give them, and the people that do it well and are early to market are going to probably gain some wins. And we're going to need those folks.
Well, what do you think doing it well looks like?
You know, as you approach accountable care sorts of organizations, doing it well looks like you can do it on a population basis, this whole notion of population health management. We've gotten pretty good at Memorial Hermann of working on ill people and driving down the cost in the ill population or the chronic disease populations. Where we need to expand is into that relative walking well population. You know, it's like 80% of the people out there. But you've got to have that large group in your encatchment, in an ACO-like population, in a managed care environment, and spread all of that cost over a large number of people. And those consumers need it to be convenient, they need to have access, they need it to be cost effective, because the general walking well consumer, you know, really doesn't have time to be sick.
No, absolutely. You know, at Memorial Hermann, you're also focusing a lot on the medical home, making it wall-less.
Right.
What does that mean?
Well, we've got a great medical home model, and our ACO folks have put together a lot of infrastructure to power that. But it really does well for the elderly, the chronic disease, the multiple medications, et cetera. The medical home model is a good one. But for the walking well, once again, they're wanting primary care, yes, but not necessarily at one place with one person at a particular time. They need it more on demand. They need it where they are, when they are. So the medical home without walls is trying to broaden the front door to primary care, the front door to that medical home, to include things like urgent care, convenient care centers, retail approaches, the nurse triage clinical contact centers, the web, virtual medicine, employer-based solutions. And all of those become a much bigger front door to get into a medical home. And it says to a consumer, if you get an integrated record and an integrated health plan in a commonly branded system, it doesn't matter where you're getting your primary care, as long as you have a quarterback, and you can get it done much more convenient with easier access.
Why is the model working so well for Memorial Hermann, and can it be replicated in other organizations?
Well, let me be clear. Every one of those channels that I just described has started in our environment, and competitors have started it as well. So the early indications are that they have been remarkably successful at opening that up. But we still have a lot more work to do to be sure we can do it to ourselves very well.
Okay.
But the early indications are that it looks like a strong approach to the consumer environment.
And what specifically are the opportunities do you see for innovators in this area?
Well, again, the chronic disease management space can use consumerism as well. So there's a lot of opportunities when you broaden that primary care footprint to include those channels to get it into people's homes, with tele opportunities and home care and connectivity for managing chronic disease. There's another big opportunity as you work with insurers and with Medicare Advantage plans, et cetera, to have a broad footprint of, again, those walking well people to have revenue opportunities. Because these people are either paying out of pocket to somebody, and if it's in your system, it stays in your system. But more importantly, you can start to negotiate broad-based, per member per month, per member per year, at-risk capitated arrangements. There's a huge revenue opportunity there.
Okay. What is another lasting takeaway you believe people will really benefit from?
You know, I think people talk about the sort of shifting in this manner as if we've got to stop thinking about the hospital so much because we've got to think about this consumer. And I think the real takeaway is that the healthcare systems are going to have to do it all. They've just been able to somewhat ignore this consumerism for a long time, but the hospital's here to stay. The demographics just say we're going to get older, we're going to need stuff done. We just need less stuff done per person. But as this population ages, those facilities have got to be maintained, they've got to be kept up, so it's really a both and. It's like fulfilling the entire panoply of activities across the continuum of care, but also based on acuity. So I think population health has got to include a consumer-driven approach. I guess the way to say it is, the medical home model is good, but it's still us placing the patient in the center of everything we've got. And that's better than nothing.
Right.
But the watchword is this: it's the consumer who is soon going to place us where they want us to be. The consumer will be much more active in that decision making, and we're going to need to respond to that.
Okay, we're going to have to leave it there, but it's a great place to leave it. Thank you so much, Dr.
Sure.
James.
Thanks.
Appreciate your time. And I'm Mabel Jong. Thanks for watching.